Hi, I'm Rosemary Clee, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Route, an informative conversation with leading physicians on important health topics. Today, I'm joined by Dr. John Barbaro, the Chief Medical Officer at Bergen Newbridge Medical Center and Assistant Professor of Medicine at Rutgers, New Jersey Medical School, and the Chief Medical Advisor to the Bergen County, New Jersey. As an early leader in the hospitalist movement, systems innovated by Dr. John Barbaro are now implemented at most American hospitals. In addition to his other roles, Dr. Barbaro acts as a lead physician and medical director at the medical center's COVID-19 testing and vaccination programs, and as the medical director of Bergen County's public health programs, including COVID-19 testing and vaccination programs. All of these programs operate under his physician orders and protocols. The booster conversation is intensifying as we watch the Delta variant surge among unvaccinated individuals, and health officials around the country report low but growing numbers of breakthrough cases in fully vaccinated individuals, which, though they tend to be asymptomatic or mild, are of growing concern. Today, I'm hoping our discussion will help with some confusion you may have. Welcome back, Dr. Barbaro.
Thanks. Good to be here.
Last time we spoke, we were talking about the initial dose and the safety of the vaccination. And today, we're already talking about boosters. So, are COVID vaccines safe?
Yeah, very. They're extremely safe. It's funny. Any medication, right, has its benefits and it has its side effects, right? I mean, it's true of blood pressure medication, chemotherapy, right, would be a big one, has bad side effects. Even other vaccines, the side effect profile on these are extremely low, and that's evidenced by the fact that they got such quick approval because the data was so overwhelming. And now that we've given so many doses, we have so much information. We know more on these than we do on a lot of medications. And that's what led to, I'm sure you may have seen it, but I don't know if everybody watching has the news earlier this morning that they approved the Pfizer vaccine for full approval. So that means it's gone through all of the processes a normal medication would go through. The Pfizer one now has met that. And quite frankly, it had for a while. I think the current count when I looked this morning was 360 million shots total of the various vaccines that have been given in the United States. But that's a lot of doses of a medication. And we probably have enough data on the Moderna too. I wouldn't be surprised if that one goes for full approval shortly as well. But we clearly can see that these are very, very safe and effective medications or vaccines.
So what about the protection from serious illnesses with COVID-19?
Sure. And that's really what the vaccines do best. You mentioned earlier that we're seeing breakthrough infections, but it's important to remember that I think I even said it on our last time that, I expected there at some point to be breakthrough infections, right? I think I said, at some point you're going to hear about people being hospitalized who are vaccinated. You'll hear about somebody who dies who's vaccinated, because that's just how medications work. And that's how vaccines work, right? The best way to explain it is a vaccine kind of trains your body to attack the infection when it shows up. And when you get a vaccine, that's giving you a lot of training at that time. Over time, it might not be as strong of a protection, but it's still there and it's still very good. I was trying to think of a good analogy for it this morning. The best thing I could come up with was I'm a basketball fan. So let's say, LeBron James, one of the best basketball players in the world. If he played against me right now, even if he hadn't practiced for 6 months, he'd kill me, But if he played another high-end NBA player, say Kevin Durant, maybe he'd be a step behind him for a bit, but he'd get back into it very quickly. And it's kind of a similar thing that we're seeing with the Delta variant, because it replicates so quickly. You see some breakthrough infections, but remember, it's still drastically less than in the unvaccinated populations, and it's extremely protective against the more serious disease. According to the data this morning, I looked at the updated data. Of the current people the current people hospitalized with COVID in the state of New Jersey, only 0.3% were vaccinated. Now, you got to remember that of the total people in the state of New Jersey, about 60% are vaccinated. Actually, over 82% of people over 18 are vaccinated. But yet only 0.3% of them, of the people hospitalized, were vaccinated. So yes, people who are vaccinated can get it, and can get serious disease, but that's a drastic decrease, so just the fact that people get it, and at some point, as more people get vaccinated, the percentage of vaccinated people, of hospitalized people who are vaccinated, will go up, just because they'll so far outnumber it. It's kind of like lung cancer with cigarettes.
Right.
We're at a point now where more people with lung cancer don't smoke than do. However, it's only like 5% of the population that smoke, and it's close to 50-50. So smoking still is probably not good for lung cancer, and it's the same thing. The vaccine is very, very protective against severe disease, extraordinarily so. That's what it's really good at, kind of like LeBron James playing against me, or getting his step back when he's playing Kevin Durant. But the breakthrough infections, maybe he's a step behind, but not that far off.
So the vaccinations that were given months ago, like I got mine in January, the end of January.
Yeah.
Are they still preventing infections or immunity from the vaccine?
Oh, absolutely. Yeah. And that's what we're talking about, right? So remember, when we talk about these breakthrough infections, that's what we're seeing. And it's also interesting. There's a lot of data, the official answer on all these things is we don't know 100% for sure, because we don't know until we know, and we need time to pass. That's how science works. It's just things are new. Remember, COVID-19's only been around in the world for less than 2 years. The 19 in COVID-19 stands for 2019. The first case was in October of 2019. Vaccines are less than a year old. So it takes time to have long-term knowledge. However, we have a pretty good idea. And the reason we have a good idea is because so many people have gotten vaccinated, and because we're able to look at the studies, and also in other countries where they vaccinated more people, or even some microscopic studies that they've done on the blood of people who've been vaccinated. And, an interesting thing we're seeing is in the UK, they're having a breakthrough as well, but it's not as severe as ours. You may have heard people saying like, oh, they had the Delta spike there and then it kind of calmed down. Well, first of all, they were more vaccinated than we were. But the other thing that they did differently, which is interesting, was they had a longer pause between the two doses. And we don't know for certain that the 3 weeks for Pfizer or 4 weeks for Moderna is the optimal. It's just what they tested. In the UK, they actually made everybody wait at least 10 weeks. So maybe it's just that their immunity will fade more in 10 weeks, or maybe by spacing it out more, the immunity lasts longer. We'll have to see. Or I shouldn't say lasts longer. It lasts longer for everybody. Say lasts at that high level longer. So
got it. So what about the unvaccinated and achieving herd immunity?
Yeah. So, herd immunity, you've probably heard a lot of people talk about. What that means is that you have such a large number of people who have some form of immunity that it makes it hard for the virus to replicate, and it basically becomes less of an issue. We mentioned this last time we spoke, but I'll kind of go through it again. There's been other pandemics in human history, right?
Right.
About every 100 years or so, there's been one. And the bubonic plague is probably most famous in the 1300s. The most recent one prior to this was what they call the Spanish flu in 1918. There was syphilis, was actually an epidemic that was very fatal in the early 1500s. They all tend to end the same way. All of them previous to this one lasted as a pandemic anywhere from 7 to 15 years, 10 years on average. So I don't think any of us want this to last for 10 years. But they all end in the same way. Either the infectious agent went away, which is rare. Most of the things that have gone away, like smallpox, weren't really epidemic or pandemics. Or they become what we call endemic, which means that they're around, but they're not something we worry about as much. It's something that we deal with yearly, like the Spanish flu is part of our normal flu variants. But what happened? Well, eventually, the reason why it took 10 years for it to end was because enough people got it, that enough people had immunity, that it kind of died down. And what eventually happens is that causes, you're already seeing it with the mutations, these variants like Delta. They usually mutate in two ways. One, to become more infectious, which has already happened with Delta. And they eventually become less dangerous, both from a combination of people having some immunity to something related to it, and just because that's a way for it to avoid getting detected, right? I mean, if COVID didn't make people so sick, and remember, it's not everybody who gets so sick, but the death rates are high enough that it's concerning. It fills hospitals and so forth. But if it didn't make people so sick, we wouldn't be so concerned about it.
Right.
Right. So, and if COVID became, mutated in that way, eventually, we wouldn't be so concerned about it. The way for us to not take 10 to 15 years to get there, which I don't think anybody wants, is to get to herd immunity. And we have a difference between 100 years ago, which is we have safe and effective vaccines. So you can have immunity through getting the disease, but you can also have it through getting a vaccine. And, it may take anywhere from 90 to 95% of people that have some form of immunity to get it. Now, that includes the people who get COVID. But, I said before, only about 60% in the US, I think it's 69% in New Jersey are vaccinated. Now, part of that's because, as we'll probably get to, people under 12 are not eligible to get vaccinated. And yeah, there's been a percentage of people who've had it, but we're still a chunk of the ways away from herd immunity.
So who should get the third shot or the booster shot, and why?
Sure. So I mentioned before about the immunity not being as robust early on. And that's really more what we're seeing with Delta. I don't want people to get scared that, my immunity faded away completely. It doesn't. It protects you against severe disease. What we think is happening with Delta variant is it tends to live in your nose and in your throat. And we think it just replicates so quickly that when you've been a little bit out from your second vaccination, it might be enough for you to spread it or to have mild symptoms, but probably not enough to make you severely sick. Again, we don't know 100% for sure, but that's what it kind of seems like. In terms of the third dose, in Israel, where they've started giving third doses, it seems like that has kind of made it go back to where it's harder for people to even spread it. And again, it still spreads a lot less, even in the people who vaccinated far way out, which is why we're not saying everybody get a third dose right away. So for right now, as of today, as of 11:42 a.m. Eastern time on August 23rd, the recommendation is to give a third dose to anybody who has what we call immune compromise, and is at least 4 weeks out from their second dose. So immune compromised people, what does that mean? There's very big immune compromises, like if you've had an organ transplant and you're on immune suppressive drugs for that, certain kinds of cancers, particularly blood cancers, but also stronger immune suppressive drugs or medications. Some people who have autoimmune diseases or have rheumatologic diseases might be on strong immune suppressive drugs, and those would make you immune suppressed enough that we would recommend getting the third dose. We're probably all going to need a third shot at some point, and it's actually important that they're calling it a third shot and not a booster, because again, the vaccines are new and we're figuring out what we really need. I mentioned the thing with the UK. Maybe it's just that you need a longer distance between the second and third shot, and maybe the UK won't need a booster. We don't know yet. Maybe they will. Also, there are vaccines where you, as part of it, get 3 doses, right? When I was a kid, they didn't have hepatitis B vaccine, but they did when I went to medical school, so I had to get vaccinated. My children were vaccinated as babies with it. But the way that vaccine works is you get 1 shot, you get your second shot a month later, and you get your third shot 6 months after that. Well, it could be that that's what the story is with COVID vaccines. It could be, 1 shot, 2 shots, 3 shots, and it might be that you're done. It might be that you eventually need something else in 5 years, 10 years. We don't know. But that's why they watch the data. That's why they continue to collect the data and see. So but it looks like everybody's going to need a booster at some point. We think it's going to be 8 months after your second shot, and it will probably start September 20th, but that's not definitive yet. I'm sorry I cut you off.
No, that's okay. That's okay. So the boosters,
yes.
Do you think they actually work?
Oh, yeah. Again, we see the data from Israel where they've given them, and the immunity seems to shoot right back up to that higher level again. It seems to cut down the transmission. It seems to cut down even, already this with the 2 doses, people were protected against the severe disease. It seems to cut down even the asymptomatic disease and so forth. And again, the whole point is to just cut down the transmission enough so we can get to herd immunity and protect everybody, protect yourself, but also protect everybody else and get us out and emerge from the pandemic into a more normal state again.
So how is the booster shot or the third shot different from the first 2 doses we received?
It's not.
If you received them. Okay.
Yeah, it's the exact same shot. So it's literally the same shot, just given to you a third time. And so all 3 shots are the same. An important thing, we're talking about the mRNA vaccines with the boosters
Right.
for the Johnson & Johnson or Janssen, it's sometimes called vaccine, which is a 1-shot vaccine. They have not yet released data on second shots or boosters, but it's likely that they are going to. That's what they keep saying. It also may be that they're also doing studies on mixing the different kinds of vaccines. In other words, you get a first shot of J&J and you get a second shot of Moderna or Pfizer or vice versa or whatever. So I wouldn't be surprised if shortly we hear something about boosters on Johnson & Johnson vaccines. We just haven't heard it yet. But so there could be a difference at some point, but right now it's literally the exact same thing. We've given third doses at our vaccination center here at Bergen Newbridge Medical Center and the county vaccination program, and it's the same thing. We don't change anything. We just give you a third shot and document it.
So if I receive the Moderna shot or the Pfizer shot, do I have to get the same exact Moderna or Pfizer?
That's the recommendation right now. Again, it may change that they say that it's okay to switch them, but for right now, the only thing we have data on, or enough data on, I should say, to say something definitive is to get a third shot of the same vaccine.
So does this booster or third shot protect against the Delta variant?
Yeah. I mean, right now, I think it's close to 99% of the COVID in the United States is Delta. So when we're talking about protection, everything we're talking about is with Delta variant at this point. There's some things that aren't, but the Delta variant's kind of overrun all the other ones. And that's why you're seeing the rates go up again, just because it's at least twice and maybe more infectious than the original strain was. So, you just kind of double the infectiousness of something and, it's going to happen more quickly. It's still, again, need to reiterate it, even with the 2 shots, they're still very effective. If you remember before the vaccines came out, we were saying, with a typical vaccine, we'd be really happy if it were 60% effective. They were 90% effective when they first came out. And even with the Delta variant, they're like 80-something% effective. That's still way more than usual. So we're still talking about things, even with the quote unquote fading immunity, it's still really good. It's still really good. It's real. I can't say it enough. It's better than just about any other medication or vaccine that people take without thinking twice about it for all of these years. And it's got way less side effects than those things, but again, nothing's perfect. And adding that third shot brings it right back up into that 90+% effectiveness.
So just for instance, I'm vaccinated and now I caught the Delta variant.
Yep.
Do I need to get a booster?
It's a really good question. I don't know the answer to it. Nobody does. It doesn't hurt to get the booster. I would say there's interesting data, but again, it's not definitive because it was in one study. But there was a study that came out in the last month where they studied people who got COVID immunity from just being infected, people who got COVID immunity from vaccines, and people who got COVID and then got vaccinated. And at that point, this was before everybody started giving third shots. So it's probably over a month ago now. Or we're talking about third shots. It looked like people who had COVID naturally, their immunity faded within a year. People with the vaccine, it looked like they were going to need a booster at some point. At that point, it wasn't clear when they were going to need it. And then the third group, the people who had COVID and then got vaccinated, looked like they may not ever need a booster. So if you got it and then got COVID, you might not, but it wouldn't hurt either. Like it would give you even stronger immunity. So I see somebody said, "Can I get my booster shot now?" I got two Modernas, one in February and the second in March. Again, it depends on if you are immune compromised. If you were, yes. If you weren't, right now it's not approved yet for you. It would be recommended to do it 8 months after March, so that would put you in November. But again, that could change. Like the recommendation could change, but that's where we are today. If we had a reaction to the second shot, should we expect a reaction from the third? Potentially, yeah. I mean, it depends on what reaction you had, right? If you had a normal immune response reaction like fevers, chills, body aches, and that's kind of normal with it, then yes, you could have that. If you had an allergic reaction, yes, people who have allergic reactions tend to have a repeat allergic reaction. You can get pre-treated. We've done that here at Bergen Newbridge too, where we've had patients who had an allergic reaction to even with their first shot, and we set up with them. They called us. We arranged in advance. We gave them medications in advance, and then gave them the shots, and they did just fine. We've have a patient. We've done people for both their second and third shots with pre-medicating them. So it's still possible to get it.
Okay. I keep hearing about monoclonal antibodies, and I'm sure I said that incorrect.
Monoclonal antibodies, yeah.
Where do they fit in?
Sure. So you may have heard people sometimes call it by the brand name, which is Regeneron. Okay. There was another one, bamlanivimab, but unfortunately that one didn't work against the Delta variant, so we're not using it anymore. But Regeneron does work against it. So just to go through what it is, monoclonal antibody is basically a lab-created antibody against COVID. Actually, it's two different antibodies in the mixture that attack different points to it, and we give it to people in an infusion. It's very effective if you have COVID and you have early symptoms. You have severe symptoms, it's not. It's also good if you've had a recent exposure. They've actually brought in the usage for it. It's not a replacement for being vaccinated, because you can kind of figure out why pretty easily, right? Like if I give you a vaccine, I train your body to make antibodies and other ways to have immunity against the virus. Whereas if I give you outside antibodies, those are outside antibodies, they're going to go away and they'll only last a certain amount of time. That being said, them together is a really strong treatment. And we've had actually with the increase of cases of the Delta variant, we had really hadn't given a lot of monoclonal antibody in several months. In the last month or so, we've started giving them almost exclusively to people who were vaccinated and had cases with mild symptoms, and it's worked wonders on those patients. But it works for people who weren't vaccinated as well. But again, it's not a replacement for vaccination, but it works really well hand in hand with it.
So I'm going to move on to testing, because I think this is an important factor. I mean, I'm hearing from everybody, perfect example. I'm fully vaccinated. Do I still need to get tested?
So, I mean, it's a great question, right? And what we kind of keep saying is nothing is perfect, right? So the vaccines are very, very good, but they're not perfect. Testing is very, very good. It's not perfect. Masks are very good. They're not perfect. And, again, if you point to cases where things break through, yeah, of course, it's always going to happen. Like I said before, I know people who've died on chemotherapy. I know people who've died on heart medication and so forth. That doesn't mean that those medications aren't good. It just means that they're not perfect. Unfortunately, we live in an imperfect world. Testing is another layer, and it's very effective, and it's another really powerful way to help control the pandemic is frequent testing. Now, do you have to do it if you've been vaccinated? No, you don't have to do anything, but it doesn't hurt. And clearly, so I work in a hospital, I still get tested regularly. But, I'm also a frontline, I'm a first responder, frontline medical worker. I'm in a different situation than somebody who's not. That being said, if you've been exposed to somebody, even if you're vaccinated, if you've had what we call a close contact, which means more than 15 minutes within 72 hours of somebody having symptoms, you should probably get tested. If you're in a job that has a high risk or you do activities that has a high risk of being exposed, you should probably get tested, even if you're vaccinated. How frequently do you need to test? Not entirely clear. Obviously, the more the better, although there's a certain point where we could just be doing overkill, right? If you did it every day, you're probably not going to get a lot of extra information, but every week or twice a week for really high risk things, but even every 2 weeks or anything else is not it doesn't hurt. So all of these things are just extra levels. Sometimes in medicine, they do this thing, they call it the Swiss cheese model. I don't know if you've ever seen it. People out there who aren't medical definitely have never seen it. But the idea is that everything you put up, every treatment you have, every protection you have is like a barrier, but like a piece of Swiss cheese, it's got some holes in it. There's some ways that it doesn't work. So the idea is you put up one piece of Swiss cheese, you put another piece of Swiss cheese behind it, and some holes will line up, but some won't, and you'll do another block. And if you keep adding layers of Swiss cheese, eventually you hopefully block all the holes. You might not. 100% depends on how big the Swiss cheese is and how many holes. to really drive this metaphor to an absurd point, but that's the idea.
So finally, I mean, you've talked about, some of the testing and what we should do. Is it a good idea to get tested before traveling? And moreover, is it a good idea when you're coming back from traveling to get tested again?
Again, it doesn't hurt. I mean, some countries require it, right? There are certain countries where you can't get in without being tested. So at that point, it's a moot point. If you want to go there, you got to be tested. It doesn't hurt, right, to know your status, and so that, again, you don't spread it to people. And definitely when you come back, I would definitely recommend, especially if you've gone out of the country or out of the area. If you're, if I live in New Jersey, if I travel to Connecticut, I probably don't need to be tested for that traveling, or to Pennsylvania or something. But, if I travel to another country, I probably would get myself tested. Somebody said, did you say monoclonal antibody works for dental variants? No, I don't. Delta variant.
Delta.
Do you mean Delta variant? Yeah, it does work for the Delta variant, particularly the Regeneron. It does. Yeah. The Bamluvimab, the old one that we used to use, did not work on Delta. So nobody's giving that anymore. It's been pulled from the market. So if you went in and got it, you wouldn't get the one that doesn't work on Delta. So here at Newbridge, we only give the Regeneron. Can we get a digital version passport of the fact we were vaccinated at Newbridge to see it? Yes, you can actually. The state of New Jersey and some other places as well are using it as well. There's an app you can download on your phone. It's called Docket. Just put if you have an Android phone, I actually have it on my phone. If you have an Android phone or an iPhone, you can download Docket. And New Jersey is set up with it. Other states are too. I don't know the list of every state that is, but it's automatically, if you put in your information, it will check the state database and it will download your information. And it's a verified thing. So that is a verified passport. So that's available out there and it's free. So you definitely can do that. And I do recommend it to people to get it done. I told all my family members to do it as well. I said, download this thing, put it on. That way you have it. You're all set. I have it on my phone.
Just as a side note, Stephen, just to add to it, personal experience. Again, I'm not an expert, but my daughter had the vaccination, and she got the vaccination in Pennsylvania. And we didn't think we'd be able to upload that information onto Docket, and there it was. It appeared. It was like magic.
So yeah, so, like I said, a lot of states are doing it. Not every state is. So I can only speak for New Jersey. Clearly, Pennsylvania must be as well. I wouldn't be surprised if other states in our area weren't set up with it, but I just don't know the full list.
Yeah. So just to talk a little bit, we talked about 12 and up. To get the vaccination. Yeah. When do you foresee children being able to get the vaccination? I know this is a top of mind for parents. I mean, school's starting, they're requiring masks in a lot of states. So when do you think this will be approved?
I'll be honest with you, it's my number one concern. I have an 8-year-old and twin 5-year-olds. So for me, it's probably my number one concern is when can my children be vaccinated? Again, we don't know for certain. Because I don't work for Pfizer or Moderna, and I don't work on their studies. Right. But I know what they've been saying. And Moderna, for a long time, have been saying that they would have theirs by early September, although they recently had to dial that back because I don't want to get overly technical. There's a thing when you design studies called powering the study. It means figuring out how many people you have to put into the study ahead of time to, one, show an appropriate effect, and two, to rule out certain side effects. And the smaller the effect of something, the more people you need. That's not the case with the vaccines because they're so effective. However, the more rare a side effect, the more people you need to enroll. And so because what side effects we've seen with these vaccines have been so rare, they recently announced that they had to widen the number of people they were enrolling, and they kicked back what they were saying to probably the end of the year. Pfizer is still saying that before September ends, they're going to release their data for ages 5 to 12. That's what they're saying. Now, might they change that? Of course they would. I don't have any inside knowledge, but they're saying that they'll release their data sometime in September for ages 5 to 12. Remember, that doesn't mean that it's approved that day. As we've seen with everything else, there's a process, and it means that people review it to make sure it's all on the up and up, which is appropriate to do. So my guess, assuming that Pfizer stays on their timeline, is, at the earliest end of October, probably end of November. And then remember, there's time you get a first shot, you have to wait, get a second shot in 2 weeks after you have immunity. So, worst case scenario, if the things come out at the end of the year, we'll still have it sometime this school year. It's just a matter of when. So there will probably be shots available for younger children, maybe not under 5 yet, but probably before the school year ends. I'm hoping before the end of the actual calendar year, but time will tell. Is there a plan for appointments for the third shots? Will folks who got vaccinated early on get a preference? So we take, again, it depends on the place you're getting vaccinated. I can speak to Bergen Newbridge Medical Center. We take both walk-ins and we take appointments. It's obviously easier if you do an appointment, but if you got your first shot with your first or second shot with us, you're in our computer system, so it's actually pretty easy. As long as you come during our open hours, look to see what the hours are. They've changed a bit. You can go to newbridgehealth.org for more information. I should add, but it really depends on the site. The reality is that with third shots, are people who got it earlier going to be preference? Well, because they're the ones who are going to be 8 months out sooner. So yeah, but really more just from a practical way. Will Newbridge and or Bergen County be running a mass vaccination program similar to the one they ran earlier this year? If there's demand for it, yes. Our vaccination center is still open. Our mobile units still go out to communities and are still doing a lot of work out in the communities as people ask for us, or even as we arrange. We've been doing what we call our Vax to School events for people under 18 before they go back to school. So, we continue to mass vaccinate, and, if we see that lots of people are wanting it, we'll ramp up what we have. I mean, we have the resources to do it. It's just a matter of just seeing what people want. But we never stopped vaccinating. Both on the, I'm the medical director of the county program as well, and neither of them ever stopped. The county still does weekly things where they go out and vaccinate people. We still have our site open, and we do mobile units at Newbridge as well. So we've been doing a lot of vaccinating.
So I can't thank you enough for taking the time, Dr. Barbaro, to sit with me to, clarify some of these questions. And, again, taking the time. I'm hoping that we are on our way to that herd immunity and more people will get vaccinated as needed.
I hope so too.
Yeah. So if you want to learn more about our vaccination program, about, COVID testing, please visit us at newbridgehealth.org. And of course, if you'd like to support our foundation, you can visit us at bergennewbridge.org/foundation. And thank you so much again.
Thank you. And get vaccinated.